Hi, it's me, Zoisa again. So I wanted to say it might be normal, but it's not for me. So that might be something that you've either said to your friends or maybe you've heard somebody say that. And I know for myself, I've experienced that recently with going, why am I so exhausted? Why am I so fatigued? And then it's like I can usually bounce back from things quicker or faster. And then go to the doctors that I've had the checkups and the tests, and again it's like, well, the blood's come back and everything appears normal. And recently I had a client who came to me initially at the beginning, kind of end of Jan, beginning of February, and they were feeling quite anxious and a bit of unsure. And so I work with my reiki and my kinesiology, and which has some NLP techniques, and we work with batch flower remedies to really help and support them and to get that foundation. We also looked at food and what was happening there. So things started to improve and get a little bit better. And then she contacted me again, feeling quite distressed, very purple, kind of like purple in the face, sitting around in February in a t-shirt, but being boiling hot. And for me, I was like, this is not normal. And again, having a conversation with her, she goes like, no, this is not normal. This is not a normal reaction to be bright purple, and feeling boiling hot. And this, it's not that I've just run around or been exhausted. It was like perimenopause. That's what kind of like came to mind for me, and the hot flush symptoms. And we had a conversation about where she was in a cycle and what else was going on. And so my recommendation was to let's see what's going on with the hormones, particularly the sex hormones, and looking at that triangle of hormone health, as I do with the kinesiology journey. And also recommended that she go to seek professional guidance from the doctors, get some blood tests so that we could see if there was anything underlying. So what was really interesting is I did the kinesiology testing, and it actually showed that actually there was something hormonal that was going on and that was relevant for her. Whilst I am able to test to see what's going on with the sex hormones and the balance of those energies, I don't diagnose what's going on with hormones. I can just tell you your body is telling me that there's an issue and an imbalance. There's something happening in this realm, and we need to kind of like dig a little bit deeper and find out more about what's going on. And this is where there are people who have you can do the blood tests to seek further guidance, and this is something that I do recommend. And what is fantastic is that we also have a menopause clinic here. But anyway, so she reached out to her doctors and then had the blood tests. But actually, when they came back, again, the blood tests it was normal, and we're not detecting any hormone changes that will confirm that you are going through menopause or perimenopause. And this is actually a common experience and something that happens quite frequently. And what I find that's interesting is to consider, it's like, well, what are the actual tests and what are the numbers and the statistics? So I would always recommend, if you're going to have some blood tests or go and see the doctors, to ask to see, it's like, well, what are those numbers? What are the results? And what exactly have you tested? And also the other consideration is when they draw that blood or take that blood, that's just a snapshot. So it actually depends. It's like, well, where are you in your cycle and what else is going on at that time? Because if you think about with your normal cycle, we have kind of like the estrogen and then the progesterone, and then they tail off. So they're at different phases, and we have our follicle stimulating hormones. So it's actually, we want to get that bigger picture of what is happening through the journey of the hormones. Because when it comes to estrogen, it really starts to roller coaster, and the progesterone starts to taper down when you're in the perimenopause. I know for me there were little changes. It was very subtle. So maybe the consistency of your period changes, maybe the color, the texture, All of these different changes can happen through your periods, and that's something that you know personally. Or maybe you're like, well, actually it was a bit shorter this month, or it's a little bit longer, or usually it's bang on time but it was like a couple of days. And so it's really good to keep track, and also your body temperature. It's like, what's that been doing, so that you find a way for yourself to track what is normal for you, so that actually you can then go back and go, well, your results might say it's normal, but no, I want to have more information. And really my role is to work with the tools that I have and to be able to support and find what are the adaptogens or what are the supplements to help. Sorry about the wind going on in the background. Bit like menopause or perimenopause, it's all happening here. So what is it that's happening to your body, and how can I support you through that journey? Because it is really about education and learning what is normal for you and what happens and occurs with your cycle. If you want to find out more about cycles and really looking at that bigger picture of health, so I'm also going to be doing my Take Control of Your Health workshop, which is coming up in June. And also, if you want to find out more about what's going on with your health, then again, you can contact me for a one-to-one session or just a discovery call to find out how I can help.